भारतीय सभ्यता का एक अनमोल खजाना है आयुर्वेदा। माना जाता है कि आयुर्वेदा की शुरुआत ब्रह्मा जी से हुई। ब्रह्म जी ने आयुर्वेदा का ज्ञान दक्ष प्रजापति को दिया। दक्ष प्रजापति से ये विद्या अश्विनी कुमार देवताओं के वैद्य तक पहुंची। अश्विनी कुमारों ने इस ज्ञान को इंद्रदेव को दिया। आज बहुत से अच्छे आयुर्वेदिक चिकित्सक इस ज्ञान की मदद से पूरी दुनिया में लाखों लोगों को आरोग्य लाभ दे रहे हैं। उन्हीं में से एक उत्कृष्ट चिकित्सक हैं डॉक्टर नवदीप शर्मा। डॉक्टर नवदीप शर्मा स्वर्ण मंदिर शहर से जुड़े एक आध्यात्मिक चिकित्सक हैं। आयुर्वेद के अंदर अपनी ग्रेजुएशन श्री लक्ष्मी नारायण आयुर्वेदिक कॉलेज से की, जो हमारे देश के पुराने और प्रसिद्ध संस्थानों में से एक है। यह कॉलेज श्री दुर्ग्याना एजुकेशन फाउंडेशन से जुड़ा हुआ है। उन्होंने मद्रास यूनिवर्सिटी से मास्टर डिग्री की है। उन्होंने मानसिक रोगों में आयुर्वेदिक जड़ी बूटियों के उपयोग विषय पर पीएचडी की है। आयुर्वेद को बढ़ावा देने और दुनिया के अलग अलग देशों में आयुर्वेदिक इलाज और पंचकर्मा केंद्र शुरू करने के लिए उनका नाम वर्ल्ड बुक ऑफ रिकॉर्ड्स में शामिल किया गया है।
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
ब्रिटेन में बसा भारत का डंका, नवदीप शर्मा और डॉक्टर मोनिका शर्मा को मिला आउटस्टैंडिंग कॉन्ट्रीब्यूशन टू आयुर्वेदिक हेल्थ सर्विस पुरस्कार।
लंदन में इंडो यूके लीडरशिप समिट का आयोजन, आयुर्वेद को लेकर जागरूकता पर जोर, द वर्ल्ड बुक ऑफ रिकॉर्ड्स इन लोगों को किया सम्मानित।
डॉक्टर नवदीप शर्मा को अखिल भारतीय आयुर्वेद महासम्मेलन द्वारा प्राणाचार्य की उपाधि से भी सम्मानित किया गया है।
आयुर्वेदिक डॉक्टर नवदीप शर्मा को युवा प्राणाचार्य की उपाधि दी गई। भारतीय आयुर्वेद महासम्मेलन में सम्मानित किया गया। कार्यक्रम में मनोज तिवारी मौजूद रहे।
नवदीप शर्मा को विश्व के सबसे युवा प्राणाचार्य की उपाधि मिली। अखिल भारतीय आयुर्वेद महासम्मेलन में मनोज तिवारी भी शामिल हुए।
Up next, most trusted Ayurveda-based healthcare brand of the year, and it goes to ND Care Nirogam Private Limited. Dr. Navdeep Sharma, Director, to please join us on stage.
देखिए, अटल बिहारी वाजपेयी जी हमारे लिए बड़े ऑनर्ड हमारे प्राइम मिनिस्टर रहे हैं, बहुत बड़े लीडर रहे हैं, और उनका अवार्ड, उनके सम्मान में किए गए समागम में अवार्ड मिलना अपने आप में बहुत मायने रखता है।
ब्रिटिश संसद यूके में आयुर्वेदिक सेवाओं में उत्कृष्ट नेतृत्व के लिए एनडी केयर निरोगम प्राइवेट लिमिटेड की ओर से डॉक्टर नवदीप शर्मा और डॉक्टर मोनिका शर्मा को कमेंडेबल ग्लोबल रिकॉग्निशन अवार्ड प्रदान किया गया। डॉक्टर नवदीप शर्मा को ऑटिज्म और मानसिक
A very warm welcome to all of you in this live interactive session of ours, where we generally try to discuss quality Ayurveda with you. And while we are discussing Ayurveda with you, we also try to take the maximum of your question. नमस्कार, मैं डॉक्टर नवदीप शर्मा आप सभी का हमारे इस लाइव इंटरैक्टिव सेशन में स्वागत करता हूं, और मैं आशा करता हूं कि इस बार भी हर बार की तरह ही आपके मैक्सिमम क्वेश्चंस का आंसर देने के साथ साथ हम आयुर्वेद की कुछ बढ़िया बातें भी आपके साथ जरूर कर पाएंगे। Since many of you are parents of autistic kids who, if they are residing in areas where the cold wave has been really intense, the chances of child going out as compared to the chances of child going out when the temperatures were normal become lesser. The activity becomes confined, and as a result of all those things, at times when the weather goes drastically chilling, especially for our patients from Edmonton, Calgary, UK, US, and in northern parts of India, since the temperature has gone drastically down, so the child may show increased hyperactivity for a few days, which needs to be compensated by increasing the dosage of the Breno-R which is being given, and at the same time the dosage of pumpkin oil seed can be increased. The Shiropichu, which is generally done for the children, that Shiropichu can be done to a greater frequency for the child, and along with that the ABA sessions which are being done, that needs to be increased. So for a month or 1.5 months, the child may require a greater attention so that any kind of agonizing symptoms do not appear in the child. So I thought it was very important for you to be knowing, as parents, it is only for a few days, as the temperatures will normalize, you will see all those agonizing signs going away. So I'll be moving directly towards your questions, which are really very important for us always. And the first question which I can see over here is from Dakshit Gupta ji. Dakshit ji ke jo father हैं Anil ji, you are there with us from Jharkhand, and you have mentioned कि जय हिंद सर, जय हिंद अपना अनिल जी। और दक्षिण की स्पीच नहीं है, बैबलिंग ऑफ वर्ड्स है, 10 वर्ड्स बोलता है बट मीनिंगफुल नहीं, हाइपर एक्टिविटी है सर, कभी कभी बहुत ज़्यादा क्राई करता है, टंग को हैंड पकड़ाता है। दक्षित में रिकॉग्निशन आइडेंटिफिकेशन अभी तक नहीं आई है, सोशलाइजेशन में थोड़ा इंप्रूवमेंट है सर, कब तक ठीक होगा दक्षित सर? 3.9 ईयर्स एज है और फरवरी 2025 में आप जो हैं एक बार मिले हैं मुझे, और उसके बाद मई 2025 में हम लोग मिले हैं, लेकिन उसके बाद से हमारी कोई मुलाकात नहीं हुई है। सो मेरी आपसे विनती रहेगी, जो मैं हमेशा पेरेंट्स को बताता हूँ, 6 महीने में एक बार मिलना बहुत ज़रूरी है, क्योंकि वो जो डायरेक्ट ऑब्जर्वेशन मुझे इंसाइट दे देती है बच्चे के बारे में, और फिर करिकुलम्स को कई बार बदलना होता है। मेरा हमेशा कोशिश रहती है कि ये सारी की सारी चीज़ें मैं बच्चे के साथ अगर मिल कर के करता हूँ तो रिजल्ट्स और बढ़िया आते हैं। तो मेरी आपसे रिक्वेस्ट यही रहेगी कि अगर इन बिटवीन मेरा कोई ओपीडी जो है आपको उसका करिकुलम सूटेबल लगता है, प्लीज़ आप मिलिए। इफ़ यू आर फ्रॉम यूके, आई वुड लाइक टू अपडेट यू दैट फ्रॉम 9th to 13th I'll be available over there for the meets, 9th to 13th. So I can't comment if all the sessions are already booked up or the team is having few sessions. That is something which I exactly don't know, but I am updating you about the dates. You can get back to your coordinators for the same. If you are in UAE, so for Abu Dhabi and Dubai, it will be on the 15th and 16th. So for all of you who are from there, you can get back to your coordinators for the same. So going to the next question. The next question, as I can see, is from the ID Peaceful Progress. So I would like to have your question also. I acknowledge your ID and you're sending us a message, but if I can have some further details from your end, I would be coming back to your question. When we say autism, and when we say autism is a disease which actually is only a temporary phase in the life of a child, it should not be termed as a disease like it is done in allopathy. We are very true about that, because by utilizing the Ayurvedic Dev Vipashe, Yukti Vipashe and Sattva Vajra Chikitsa, and for properly harnessing the Sattva Vajra Chikitsa, I had to study psychotherapy. So when we combine the Dev Vipashe, Yukti Vipashe and Sattva Vajra Chikitsa of Ayurveda, the results in autistic kids are miraculous. The only problem which at times we face is that at times the parents are willing to give any kind of medication to their child, but they are not willing to give their time to the child. There are other parents who are willing to give time to their child. They are not willing to give the right kind of herbs to the child. What we are to understand is that since anything which we are giving to a child is a proven research, so it is not a kind of trial which is being done for your child. It becomes very important that rather than trying something new for your child, if you are there with us, if you know us, what we have been doing for thousands and thousands of children, it is always advisable if that is something which you accept for your child and you follow for your child. So for all of you who are there with us, Ayurveda and ABA are equally important. They become very important and they complement each other for bringing your child out of autism. So before we go further, we will be taking a small break from your end, a small break, a very small break. So be there with us. After this small break, I'll be getting back to you.
क्या करूं? मुझे तो कुछ याद ही नहीं हो रहा। काश मैं अपने बच्चे के लिए उसके एग्जाम में कुछ मदद कर पाती।
हमारे समय में तो मेरी दादी माँ कुछ खास जड़ी बूटी मिला के और बादाम मिला के हमें पीने के लिए दिया करती थी, और यकीन मानो हमें उसे बहुत याद रहता था।
बेस्ट ऑफ लक बेटा। थैंक यू। मुझे तो कुछ याद ही नहीं होता है।
हमारे बच्चे को तो कुछ याद ही नहीं होता।
क्या करें?
आज के इस जमाने में हम वो सब तो नहीं कर सकते जो हमारे दादा दादा किया करते थे, लेकिन अब एक कंपनी है जो आज भी की तरह सबकी सेहत का ध्यान रखती है, रिश्त पुष्ट। रिश्त पुष्ट ब्रेनो ए सिरप से आपके बच्चे की याददाश्त और कंसंट्रेशन दोनों इंप्रूव होते हैं। पुराने नुस्खे, माँ बाप का प्यार, रिश्त पुष्ट ब्रेनो ए सिरप।
रिश्त पुष्ट ब्रेनो ए पीने के बाद मुझे तो सब याद रह रहा है।
Excellent job. We are incredibly proud of your hard work.
थैंक यू मैम। आप भी अपने बच्चे को उसके एग्जाम में सपोर्ट देने के लिए रिश्त पुष्ट ब्रेनो ए का सही चुनाव कर सकते हैं।
So welcome back. That was Breno A for all those parents where they face that now it is examination time and they really want to supplement their child with something. But coming back to the all important topics which we always discuss with you, autism, a phase in which a child really needs support from you. So we'll be going to the next question. The next question is, Joe is very hyper and isn't sleeping well, only sleeping for 2-3 hours per night since last 3 days. He's agitated and hurting himself if we ask him to do an activity, very vocal these days and rocking too much. He's not listening anything and running a lot. If we ask him to do something, then he shows agitation. And Ashima is the coordinator, and it's about Harjot Singh. And we definitely will be meeting each other in February. And currently, as I can see, it is Brenoir concentrated, Brenoir hot sip DS. The dose we increased the last time, and Mukta Pishti is going on, pumpkin seed oil is going on, Jatamansi oil is going on, sandalwood oil is going on, Sarpagandha, what is going on. But Sarpagandha, what you are giving, one in the morning, one in the evening, please give it 2 at night rather than giving it in the morning. Shirobasti is going on with Jatamansi oil on alternate days, head massage with lavender oil, and 10 sessions of Shirobasti have been done till now. Twice a week sessions are done with Rahul. And what I would further like to understand over here is that you have completed 52 sessions with Minuji. The most important thing which we need to understand over here is that there are phases when we are doing pranic healing when a child may respond like this. Please do remember, do not miss out on the pranic healing sessions over here. They are very important. And if possible, take him for a break, maybe at a place which he likes for a day or two. Try changing the regular place where he's living, if it's possible for you. Otherwise, since we changed everything up the last week when I guided and when I took the question in the group OPD last week, so I guided certain changes which it has been updated to me that the changes have been done. So wait for another 1 week. I'm very hopeful that the changes are about to come in his case. Don't worry. It will take another 7 days. By the time the changes which we have made should be active in his body to give the desired kind of results which we want in him. Going further ahead, ऋषि सिन्हा जी. ऋषि जी, आपका सवाल है, इसके साथ साथ ज़िद्दी बहुत है, इंटरेक्शन नहीं करता है, हम बुलाते हैं इग्नोर करता है, लेकिन सर कुछ चीज़ों में इम्प्रूवमेंट भी हमने नोटिस किया है. अब उसका टेंशन एंड एग्रेसिवनेस थोड़ा बेटर हुआ है पहले से. कमांड फॉलोइंग जो है उसका वो भी काफ़ी इम्प्रूव्ड है. ऑल्सो इमिटेशन एंड रिपीट करना नहीं चाहता, जिसकी वजह से उसकी स्टडीज़ जो हैं वो इफ़ेक्ट हो रही हैं. डिटेल्स जो मुझे बताई गई हैं, मुझे बताया गया है कि हम बात कर रहे हैं रितम की. रितम जो कि पुणे महाराष्ट्र से हैं. ऋषि जी, आप हमारे साथ हैं और जून 11 2025 को एक वीसी के द्वारा हमने ट्रीटमेंट स्टार्ट की. 31 दिसंबर को जो है वो आपने आगे अपना दोबारा से मेडिसिन रिपीट कराई. लेकिन यहाँ मैं बताना चाहूँगा ऋषि जी, बहुत ज़रूरी है, जो कि मैं पेरेंट्स को बोलता हूँ, 6 महीने में एक बार मिलना, जो कि मैंने अभी भी एक पेरेंट को बताया. इम्प्रूवमेंट्स डेफिनेटली आएंगे, लेकिन हमारा मकसद केवल इम्प्रूवमेंट नहीं है. हमने अगर आपको वादा किया है कि जरूर निकाल के लाएंगे उस मालिक की दया से बच्चे को ऑटिज्म से बाहर, तो निकालेंगे, लेकिन आपको भी अपना वादा निभाना है। और इस केस में तो अभी रिसेंटली मेरी मुंबई ओपीडी होकर के हटी है। सो ये तो हमें जरूर चाहिए था ऋषि जी कि आप रितम को लेकर मेरे पास आते और हम कहीं मिल लेते तो हम और बेहतर कर पाता। लेकिन अब मैं यही चाहूँगा, हालांकि दवाइयाँ डिटेल्स मेरे पास हैं और रितम पहले से बेटर भी है, जितनी जल्दी पॉसिबल हो सकता है एक बार मिलें ज़रूर। देखिए, साल में केवल 2 बार ही मैं मिल पाऊँगा आपको, लेकिन साल में वो 2 बार मिलना बहुत मायने रखता है। हम जिस रोग से अपने बच्चे को बाहर निकालना चाह रहे हैं, जिस पे जीतना चाह रहे हैं, वो पूरी तरह संभव है। लेकिन वो पूरी तरह संभव करने के लिए हमें 6 महीने में एक बार मिलना संभव ज़रूर करना है। भले ही कुछ भी हो जाए, हमें मिस नहीं करना है। और इस बार भी मेरा महाराष्ट्र का ऑल ऑफ अ सडन जो विज़िट था, उसमें मुझे बताना ही इसीलिए पेरेंट्स के लिए मेरे को समय इसीलिए निकालना पड़ा, क्योंकि मुझे पता था कि कुछ पेरेंट्स ऐसे हैं जिनके लिए आना थोड़ा-सा टफ हो रहा है। सो यही कारण है कि मैंने वो मीट रखी थी जो किसी कारण से आपकी मिस हो गई होगी। लेकिन अब कोशिश करें, 6 महीने से अधिक अगर हो चुके हैं, यूं ही दवाइयों से बेटर है एक बार मिलना। आप में से हर वो पेरेंट जिनको इम्प्रूवमेंट दिख भी रही है, जिनको एक्स्ट्रा ऑर्डिनरी इम्प्रूवमेंट भी दिख रही है, प्लीज़ इस बात पे याद रखिए, 6 महीने में एक बार मिलने से कोताही हमें नहीं करनी है। दैट इज़ रियली वेरी इंपॉर्टेंट फॉर ऑल ऑफ यू हु आर देयर एट यूके। सी, I could have easily avoided visiting UK had it been possible that we can carry on with the same kind of treatment, with the same kind of stuff, and meeting once in 6 months is not important. I could have saved on so many trips for my time, but I know the importance of meeting every 6 months. That was done during my research for all the children who came out of autism, and that is what I've been doing. So where the parents, they ignore meeting once in 6 months, the things are partially analyzed in that case, and that gives a lesser improvement. So it becomes really very important over here also that we meet, we analyze, and we do any kind of change if required. Going further ahead, मान्या अरोड़ा जी, मान्या जी, आपका सवाल है, सर मेरे बच्चे को 6 मंथ्स हो गए हैं आपके यहाँ से ट्रीटमेंट लेते हुए और उसे बहुत ही अच्छी इंप्रूवमेंट्स हैं। पहले वो बैठा नहीं था, लेकिन अब उसने बैठना शुरू कर दिया है। बहुत बढ़िया बात है मान्या जी, और यूं ही आप मेहनत करते रहें, आप देखेंगे आगे आगे और भी जो इम्प्रूवमेंट्स हम जो चाहते हैं, जो आप उम्मीद करते हैं, जिसके लिए मेहनत कर रहे हैं, वो इम्प्रूवमेंट्स भी ज़रूर आती जाएंगी। जावेद जी, जावेद जी आपने मेंशन किया है, कोऑर्डिनेटर वासु, सर मुझे मेडिसिन मिल गई है, आयात की एज 8 साल है, पूरा ध्यान देने से आयात नॉर्मल हो पाएगा? जावेद जी, आप बिल्कुल चिंता मत लगाएं। देखिए, मैं ये तो नहीं जानता हूँ कि आयात जो है वो मुझसे मिल करके उसका इलाज शुरू किया गया है या ऑनलाइन किया गया है, लेकिन याद रखिएगा हमारा इलाज दवा और एबीए दोनों का कॉम्बिनेशन है। सो मेरी आपसे विनती है, भले ही आपका इलाज आयात का मेरे अंडर चल रहा है या मेरी टीम के किसी डॉक्टर के अंडर चल रहा है, जितनी इंपॉर्टेंस हमने देनी है दवा को, उतनी ही इंपॉर्टेंस हमने देनी है जो एबीए के सेशंस हम करवाते हैं उनको। किसी भी कीमत पे हमने सेशंस को जो है वो लाइटली नहीं लेना है। Many a times the parents, they will take the herbs which we guide, the herbs which we guide are taken by them, but then they become a bit relaxed when it comes to session. And many a times when the child improves by 50, 60, 65, 70%, the parents may go relaxed. What is important for all of us here to realize is that even if there is 10% difference of your child from a normal child, it will later on become really very tough. We need 100% recovery, 100% coming out of this phase for the child to be absolutely perfect. और जावेद जी, मुझे बताया गया है आपके केस में कि आयात के केस में हाइपर एक्टिविटी, स्पीच और सिटिंग, ये 3 चीज़ें हैं जिसके लिए जो है सारे का सारा ट्रीटमेंट हम दे रहे हैं। और आप बिल्कुल चिंता मत लगाएं। और अभी भी मेरे पास बाकी डिटेल्स तो आई हैं, लेकिन मेरे पास ऐसी डिटेल नहीं आई है कि क्या हम लोग मिले या नहीं मिले। तो अगर हम नहीं भी मिले हैं, जैसा कि मैंने आपको बताया, प्लीज़ इस बात का ध्यान रखिए कि आपको एबीए और मेडिसिन दोनों का इस्तेमाल करना है, केवल दवाइयों का इस्तेमाल नहीं करना है। एंड फॉर एनी वन ऑफ यू, सी, we are having a huge team of doctors who are always there 24/7 for guiding you up in all kind of things, but I personally do ensure that I still keep on taking some new cases out. So that is why I keep my meets internationally in UK, US, Canada, Australia, I keep, and UAE, I keep my meets very consistent in these countries. And for India, it is my OPDs in various parts of India. So you can approach the coordinators for that. आप उनसे बात कर सकते हैं जहां भी पॉसिबिलिटी लगती है और मुझे लगता है कि मैं पेशेंट को देख सकता हूं, मेरी कोशिश रहेगी कि बच्चे से मिलकर के मैं इलाज शुरू करूं। और जहां वो संभव नहीं बन पाता, बहुत ही माहिर टीम है हमारी, चाहे वो वीडियो कॉन्फ्रेंसिंग के थ्रू है, चाहे वो मिलने के थ्रू है, आपकी हमेशा वो पूरी मदद ज़रूर करेंगे। सो गोइंग फर्दर अहेड, द नेक्स्ट क्वेश्चन इज फ्रॉम जॉन विक। Hello, sir. We are concerned about gut health of our son. He passes stool 7 to 8 times a day, giving bowel care and probiotic as you suggested. Yes, if the child is going for a motion 7 to 8 times a day, despite taking bowel care as well as despite taking probiotic, we need to be working on that, because it becomes very important that the gut health improves. And as I can see over here, Ansh is 9.10 years in age, and you started it in October 10, 2025. I hope we are meeting in the coming February. Please do get back to your coordinators for that. And Manas Matra Rakavan Brahmivati has been stopped. Brenoir Hotship Mild, Brenoir Concentrated, Brenoir Hotship DS, Mukta Pishti Premium, Organic Edible Pumpkin Seed Oil have been given. Bowel care was recently started and it's one tablet that is being given. But as I can see, the age is 9.11 years. So we will be requiring bowel care tablets all 3 times a day. And if it is bowel care capsules, then one capsule twice a day. Then we can expect that frequency of stool to come down. Another thing which you have to do is take a glass of milk, add half a lemon in it, and when you put the lemon in it, the milk gets spoiled. The water separates, the protein separates. Now filter out the water of milk and add a bit of jeera in it, a bit of black pepper in it, and give it to your child at least once in a day to take for a month. That will really sort out, and the quantity should not be more than 50 ml. So do that for the child, and you will also see improvement in that case also. Another thing which I can see over there is that 8 sessions have been done with Gurpriya, and 15 sessions in total have been done, but the sessions are too less. Again, for a 9-year-old child, rather he's about to be 10. If we really want him to be coming out of autism, if we really want him to be at a stage where what we have promised you and that basically is fulfilled, it becomes very important that while you are taking our treatments, while you are following all the medicines, it's a genuine and sincere request, also follow the ABA sessions. Now that is something which is very important. And yeah, I'm looking forward to meeting you over there, and I hope that once we meet over there, there will be further positives to come by. So for all of you who joined us today, I hope I was able to answer your questions. And one important thing which I just mentioned, meeting every 6 months is a very important factor for ensuring that the child comes out of autism. It is easier for anyone to say that autism is a lifelong condition. But believe me, that simple saying which comes from the mouth of those who don't know how to cure autism, who don't know how to bring children out of autism, that really spoils the life of so many innocent children. Because working with autistic kid all these 22 years of my life and consistently upgrading my education to ensure that nothing in this earth is left to be utilized for bringing every autistic kid out of autism, I know that a child can definitely come out of autism once the parents believe that, once the parents start working for that, and once the parents follow what is being guided to them. So, I'll end up today saying that autism is a temporary phase in the life of a child if treated timely, and a sincere and a genuine request, which I always make to all of you. Your likes for our videos really mean a lot to me. Your shares for our videos really help in propagating the right kind of Ayurveda, the right kind of treatment to people. Because when there are so many quacks going around in the market, when there are so many people merely working to give anything out without any research, without any testing to people, we believe in following everything which the ancient Ayurvedic text has given and which the modern scientific world has laid down as guidelines to ensure the safety. And that is why each and every bottle of Breno R mild, each and every bottle of Breno R DS syrup, each and every bottle of Breno R concentrated, they are made in a concentrated and small size, so that we do not have to add any kind of preservatives in them, so that each and every batch of them remains absolutely safe for your child. So, with the request that please like and share our videos, I, Dr. Navdeep Sharma, shall now be taking a break from you. Bye bye, and stay healthy and stay blessed. Namaskar.
Treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
Hello?
आ जाएगा वो।
कलर करो, वेरी गुड पार्ट, कलर करो। नो, इस हैंड से कर, वेरी गुड, इसके अंदर रख दो, वेरी गुड। पापा ना हैंड, दीदी का हैंड करो, वेरी गुड, खाओ, वेरी गुड। Hello parents, Parth, say hello, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July, we went to Dr. Navdeep Sharma, sir. The sir had told me about him. We never imagined that in just 9 months, Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today, Parth says mama, papa, and everything else with understanding. By God's grace and with sir's medicine and guidance, in just 9 months, Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, Sir. Thank you very much for bringing such great happiness into our lives. Thank you, Indian Rogam.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.
Autism is a temporary phase in the life of a child if treated timely.
Patient name:
I am Ranjit Sen. My daughter's name is Ritika Sen. She is an autistic patient. Approximately a year ago, I found Dr. Namin Sharma through a Google search, saw his professional website, and after that we promptly contacted him. Since the beginning of January 2023, we have consistently been taking the prescribed medicine. Under the supervision of Dr. Namindu Sharma, In 9 months, we have seen a lot of improvement from this medicine. In the beginning, my child used to scream. She would suddenly scream all the time. She was irritable all the time. She was hyperactive. She was extremely hyperactive. After taking the medicine, her irritability and aggression have reduced a lot. Along with the medicine, Panchakarma was also given and psychotherapy was also ongoing. So, with this combination of psychotherapy, Panchakarma and medicine, overall my child is much better now. She's much better than before. In Ayurveda, we feel that Dr. Narang Sharma is a very good doctor, especially for autism. Thank you.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.
Autism is a temporary phase in the life of a child if treated timely.
Patient name, Vivan, age, 4.5 years old, disease, autism. Chief complaints, speech delay, less understanding ability, inexpressive, sensory issues, lack of focus.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on 27 November 2022 at 11 o'clock am and felt the scope of treatment to work for the child. The chief complaints were speech delay, unable to write and sensory issues. The child could not write by himself. He was also not very socially active. Throughout the treatment, significant improvement was seen in the child. He started writing on his own, gave answers and also became active. He started interacting more and gave answers instantly. His focus also saw an improvement. He also participated voluntarily in activities and also excelled academically. Instant responses were also seen within a few months of treatment. With improved attention span, he became quick in recognizing and mind games as well. He was able to interact more with peers, participate in class and also understand things in a better way.
Hi, my name is Priya and my son is about to turn 5 years old, and it's been over a year since I've been taking medicine from Navdeep sir. And I have changed, I have seen immense change in my son. Like when we first came here, he used to say just one word at a time. And ever since we started the medicine, and along with the medicine, he's also been undergoing Shirodhara for more than a year now. And with the continued use of the medicines and everything, there has been a drastic change. Now he can express almost everything, about 99% of his things easily, and that too, he has started making full sentences also. Even academically in class, he is doing superbly awesome. He has scored 80% in his last term, and when he was in nursery, he had just scored 55%, not even 50%. And now, just in term A of junior KG, he has scored 88% marks. Now he has started writing also. Earlier, he used to write by just holding on to things. Even when holding a pencil, his grip wasn't proper. But now he has started writing as well. Plus, the main difference I have noticed from the medicine is the improvement in his sense, the development in his awareness that I wanted to see. Earlier, it didn't matter to him at all if someone was coming or going in the house. He was just operating on commands. Like he has started following my commands. But he wasn't doing anything on his own. But ever since he started taking the medicine, after 3 months, I saw more changes. Over the course of 3 months, the changes came gradually, little by little. Now within a year, there has been a drastic change. Looking at him now, you can't even tell that he had mild autism. Yes, he only had mild autism. But now he has even moved out of the mild autism spectrum. Now only a few minor symptoms remain. And we are still in touch with Navdeep sir. We are still taking the medicines. Whatever guidance he gives, whether it's about diet or his prescribed instruments, we are following that religiously, and I mean it. Along with that, we also teach him healing music so that the child heals internally as well. We are giving the medicines, so I am quite happy with the medicines and the facilities. The doctors are always available, and it's been more than a year now. I get a call from here at least once a week to check whether things are going right. They ask about Vivan, how he is doing, they are in consistent and supportive touch. The entire dedicated team has been in close communication with me for well over a year now, providing continuous assistance and updates. The essential medicines are consistently arriving here at my location precisely on time, without any delays whatsoever. We reliably receive the delivery of these crucial medications directly at our home, ensuring utmost convenience and accessibility.
Moksh was challenging as he had difficulty understanding and rarely engaged with those around him. Moksh struggled with speech delay and often seemed lost in his own world. His hyperactivity and irritative behavior made it hard for him to connect with others. After treatment from ND Care by Dr. Navdeep Sharma, Moksh has started using words to express himself, and his speech has improved significantly. Moksh is now much calmer and more focused. The hyperactivity that once overwhelmed him has reduced, and he's more at ease. We're seeing a new side of him. He's interacting more, engaging with those around him, and forming meaningful connections. His understanding has grown remarkably. He responds better, and everyday moments now feel filled with progress and joy.
Hello, my name is Pooja. My son's name is Moksh. My son is 6 years old now. When he was 3 years old, he was diagnosed with autism. When we consulted the doctor, they said that there is neither any medicine nor any cure for this. So we were very worried. My child was very hyperactive. He had no concentration, no attention, and he lacked eye contact and toilet training. We were constantly worried. Then we learned about Dr. Navdeep Sharma, so I contacted him. We started my child's treatment in November 2022, and gradually my child began to show a lot of improvement. My child's understanding improved, his eye contact increased, and now it's been almost 2 years. My child has almost recovered. Thank you so much, Dr. Navdeep Sharma. Thank you so much. You have almost cured my child. We had lost hope that my child would ever get better. Thank you so much, and above all, I want to thank Tina Mom, who is our coordinator. Mom has always motivated me.